social determinants of health, or the conditions in which people are born, grow, live, work, and age impacts their health and well-being throughout their lives.
Community engagement is really, really important because we see it very much as a vehicle to address those social determinants of health. And what it can do is that it can really sort of help us reach those that are most vulnerable. It can help us better understand the barriers that people have in terms of accessing the health systems. And it's also a way of really leveraging on local knowledge and localized solutions so that we can better do our work. In the Western Pacific region, we have communities that are not in a position to self-isolate or do not have access to clean water and soap. And that's why community engagement is of utmost importance in an emergency, because we need to better understand those localized contacts so that we can respond and support those communities. What we have seen during COVID-19 is the importance of working with community leaders. And we also understand that it cannot just be part of an emergency response. It really has to inform our long-term response to public health challenges.
The issues of equity are multiple. Sometimes it's a lack of access to services. Sometimes it's a non-utilization of services. Building on a trusted relationship helps us to determine what services need to be provided, and also helps us to improve the utilization of existing services.
Ultimately, successful communication hinges on trust. It is a process of developing relationships that enable people of a community and organizations to work together to address health-related issues and promote well-being to achieve positive impacts and health equity.
So this approach of community engagement has given us this breakthrough to primary healthcare of this, long-standing challenges on top-down approach and health sector dependent, community health, to more the ownership back to the community. Improving equity requires a tailor-made approach instead of this top-down, one-size-fits-all approach. And this grounds-up approach with a community engagement as a concrete tool, we can really enable the community to find their solutions to their particular issues. And there are things that comes out. Some of them are formal structure like village committee, and some of them are very informal, such as, if we want to bring pregnant woman to a health center, we can ask that family who has a motorbike.
Health inequity requires creativity. It's important that that's addressed beyond the walls of clinics and hospitals. And again, that's where community engagement has such an important role to play.